afternoon. Welcome and thank you for joining us for Michigan Maternal Health My Mom app podcast. Please do like and share this podcast so others can be informed about how you can be prepared and prepare your loved ones for that beautiful journey of motherhood. My name is Athena McKay. I am the Executive Director of Flint Innovative Solutions. This broadcast was brought to you by a grant funded by the National Institutes of Health called the Improve, Implementing a Maternal Health and Pregnancy Outcome Visions for Everyone initiative. Our fearless leader here at MSU and in the Flint area, Michigan area, is Dr. Jennifer Johnson. Our center is called Miracle. The beauty of childbirth is a miracle. Miracle stands for Michigan's Maternal Health Multi-Level Interventions of Racial Equity, or Miracle again. Flint Innovative Solutions has the privilege of being the community PI, or principal investigator for Project 2, which is a PRAMM project. We are developing a phenomenal app called the Michigan Healthy Mom, My Mom app to help moms and their caregivers and healthcare providers have resources to have beautiful deliveries and postpartum situations. Take a breath there. I have with me today two phenomenal guests, Miss Mary Katherine Crawford and Miss Nina Lewis. They will be sharing with us today more information so that we can get to know our members of our team, as well as how they have impacted this project and projects throughout the community. To no delay, I'll turn it over to Nina. Nina, please join me on the stage. Introduce yourself and let the folks know about you, ma'am.
Good evening, everyone. My name is Nina Lewis, and in regards to this project, I serve as one of the CAB members, and I was a part of the initiation of bringing the Apathon to Flint, Michigan. At that time, I was serving as the program director for the Healthy Flint Research Coordinating Center, HFRCC, as most of you are familiar with. I now serve as an executive director to 3 different Michigan organizations, one being the AAWR, that is the American Association of Women in Radiology, the Michigan ACC, that's the Association for Corporate Counsel, the Michigan chapter, and the International Veterinary Association for Pain Management. And so, but specifically to this role, serving on the CAB with this project, bringing the Apathon back for a 3rd time to the city of Flint, I think that we're doing such a great work moving our focus into maternal health and care and infant care. It's a very important and sometimes touchy subject, but I'm very, very glad to be a part of this work.
Thank you so much, Nina. We'll also bring in Miss Mary Katherine. Mary, please share.
Hi, thanks, Athena, and thanks, Nina. So I'm Mary Katherine, and I'm on the research team for this project. So my role will be writing and building content for the app alongside, my colleagues, including Nina, and you, Athena, as well. So when I'm outside of this project, I'm the project manager for SciAS, which is the platform that the My Mom app is going to be built on. So that is, takes up most of my time.
Thank you so much, Mary. Mary, let's dive in. You mentioned a few things, but we're very interested about SciAS. But before we dive into that, can you share about your experience around motherhood? We'll just act like I don't know you. I don't know if you have little babies or bigger babies, or if you plan to in the future, and how this work is important to you.
Yeah. So no babies of my own right now. A proud auntie and godmother to many little ones. So right now, my main focus is finishing this doctorate, but motherhood, my future plans for motherhood is something I certainly talk about with my partner frequently. And as someone deeply invested in maternal health, my future plans for motherhood are very much aligned with ensuring, a healthy and supportive journey into pregnancy. So happy to talk a little bit more about what that looks like from, not as a scientist, right, but as someone who expects to be a mother. But really, this is adapting evidence-based practices. So prenatal care, regular checkups, proper nutrition and exercise, which is a tough one, and comprehensive mental health support too. So my work has really taught me about the importance of being informed. So continuous education about maternal health. And this might range from, understanding stages of pregnancy and childbirth to being aware of potential risks and, how to address them. So for example, for me, this would be like, talking and planning with specialists about mitigating pregnancy risks with an autoimmune disease. So by aligning my, personal journey with these insights, I kind of want to go back to what you said in the beginning, Athena. We can create, healthier and more empowered experiences of motherhood.
Thank you, Mary. Nina, let me throw the same question over to you, ma'am. I have no idea who you are, quote unquote. So, do you have babies, and how close are you to this work? If you don't have babies, plan on having babies, etc.
I have lots of babies, not biological babies. And that is going to continue to be my plan for my future. I have a godson and lots of nieces and nephews, lots of girls that I've mentored. So I've experienced portions of motherhood, but the biological factor has not been a reality for me. And as I am into my 40s now, I think it's more so of unfortunately, it's a health concern at this point. I would be considered, as I said, as we were working with the Apathon, a geriatric pregnancy, and also being a minority, which part of this research is focused on. There are so many odds against having a healthy pregnancy at this age. So it can be a bit of a roller coaster sometimes emotionally, because you start to make decisions that are just best for you and for the family that you have, versus something you just want to do because you want to do it. That we have the luxury of doing that when we're a lot younger. There are other things to consider. And a lot of these topics weren't being discussed 20 years ago, when, according to the books, would have been the prime time for that sort of activity for someone like me. So it can be interesting at times, because no matter what your decision is, logically, emotionally, physically, even, our bodies tell us something completely different. Mm-hmm. And it can be confusing sometimes, because you're like, wait a minute, this is what I said, but something else is going on over here. I don't understand. And I think that's another thing to talk about, so that women feel very comfortable in that space, knowing that there's nothing wrong with you because you feel motherhood inside of you, but you've made the decision not to pursue that physically, that's not a poor choice. And that's something, you should talk about with your partner if you have one. And that's something that me and my partner have discussed in detail, and that one of his major concerns is not wanting to be that guy that has to make that terrible decision in the delivery room. Is it going to be my wife or my child? And nobody ever really thinks about that actively, that the pressure then falls to the person closest to you, which is why we've been so adamant about including the men in this conversation. So that's where I am with that.
Thank you so much for your transparency. Yeah, we think we'll live forever, and but getting crawling over that bed gets a little harder some days more than others. I'm over 42, just turned 50, and just the reality of being 50. You made some very distinct points, and then also having my daughter's 24, and the pressure of, okay, I remember back in the day when I was younger, so who you bringing to dinner, and when you getting married, when you bringing some grandchildren, and that was just the picture and the narrative for any woman. So thank you for bringing those points up, Nina. Mary, I want to pop it over to you. You mentioned too about the maternal health in general, and how this work is impacted by that. Do you want to elaborate a little more there?
Yeah. So more broadly than just maternal health is, really my dedication to public health and health equity in general. And this really has grown out of my own battle with an autoimmune illness. And from that, quickly having to learn how to navigate complex health systems, acquire health literacy, and, advocate for myself for the, healthcare access that I needed. So, when we think about the COVID-19 pandemic, and it revealed, a profoundly flawed and inequitable system. So the actions, kind of that I mentioned earlier, like, integrating evidence-based practices, like getting prenatal care, and continuing education, being informed, are really more important than ever, right? And as Nina talked about disparities, when we look at data and who is most affected by adverse pregnancy outcomes, it is Black birthing persons, right? And knowing that half of these deaths are preventable, I think for me it's just, I can't fundamentally accept that type of injustice. So it really is a personal connection to health equity, and the knowledge that I am among the privileged. I've really channeled my passion into furthering the mission to reduce pregnancy-related, deaths and illnesses, alongside, of course, my colleagues on this project.
Thank you so much, Mary. Nina, I feel you, a ball of energy. Public health is your jam. So please do elaborate here. Oh, you're muted, ma'am.
Always brilliant on mute. It's funny that it turned out that way, because it certainly wasn't the intended direction, career-wise or even just volunteering community-wise. But as my mother would say, I've been somewhat of an advocate since I was a little girl. And God bless my parents trying to figure out what to do with an advocate child that would not take injustice in the second grade classroom. It's definitely a challenge to see those disparities and continue to hear about them. And every time you think you have one covered, or you've done great work in one area, then you find out, but wait a minute, we have another one over here. And it's this never ending, cycle of, okay, we didn't get it the first time. Here we are again with the same group, the same sort of problem, the same sort of challenge, the same sort of inequity. At one point, are we going to take the knowledge that we learn from one movement and then just transfer the solutions over, because they continue to work? So it's almost as if until we get loud about something, there's not going to be any transfer of solution. We're not going to just automatically shine the light on it. So I'm very appreciative of those that are very passionate and work daily in this area, because you don't think about it until you have to make those decisions as a woman. Am I going to pursue motherhood or am I not? And in so many cases, unfortunately, that's not even a question we are asking ourselves, because pregnancy can always be this thing that just happens. And then it's like after the fact, okay, what are the things I need to consider? What questions do I ask? Who do I talk to? And when you don't know that you are part of the disparity, there are even more questions that you don't end up asking, because you're never going to go, I won't say never, but you're rarely going to go to the hospital and they tell you, you should ask us this too, because you fall into the group that has had challenges with this. That doesn't happen. So it's challenging, but then the reward is knowing that each of us have done our parts, and mine may come in, this form, making sure that we introduce technology to the community so they have to have the conversation. And then it comes in the form, of research, as Mary Katherine has, talked about and become dedicated to it. It's very important that we do have persons like you, Mary Katherine, who choose to be advocates in that space, knowing that if you never said anything, that doctor, that institution may never consider it. And that's not something that you have to do, but you make that choice to do so. And a lot of people who want to help don't realize they need to make the choice to do so, which means go walking into the room and facing the people that look like you and saying, yeah, this is not right here. We have to do something different. And I can understand how challenging that space can be. Another point that you made about how COVID highlighted, a lot of issues we didn't see were present. One of the things that unfortunately we experienced in the Flint area due to the water crisis was that we went from one crisis into another, where in some areas of the country, COVID was this brand new emergency, although none of us have ever seen anything like that in our lifetime. But Flint was very familiar with the crisis, that was citywide. What are we going to do here? What are going to be our emergency protocols? And so it's never going to be a good thing, but because of it, we were able to establish some protocols surrounding emergency. These are the questions we ask. These are the communities we need to go look into. These are the demographics we need to pay close attention to. And in doing so, one of the things that we realize is when something like that happens, it takes years for us to really see what the damage is. And so here we are years later, having been a woman who was actively living in the city of Flint during the water crisis. We talked a lot about what the poison could do to young children. We talked a lot about what the poison could do to the immunocompromised and even seniors. But that middle group that includes women of childbearing age, nobody thought about, nobody had a conversation about. And so if my decision was to try and continue to pursue motherhood, even at my age, even with it being geriatric, even with me being a minority, I would have to add to that list poison. And because it's been years and there's been no active research, we don't know what the water crisis, what that effect may have had on women of childbearing age during that time and years later. And if we go back and if we look at some of the data and see the results of some of those women, would we be able to see data that could support the water crisis having another negative effect on that demographic? And so nobody likes emergencies, nobody likes these traumatic situations. But because of what we went through, one thing that Flint knew was that we have to have a protocol in place. We have to get these things on paper. We have to pay attention because the data is going to need to be looked at very carefully.
And I just have to add that the emphasis on partnering with community after the water crisis, right? Because of this, helicopter research, because of people coming in, stealing data, leaving, publishing their papers without sustainable solutions. This is why we are doing the apathon. This is why this project has a community advisory board. This is why I'm not the only person, with a public health, background whose idea on intervention content matters, right? This is why, Nina, you're, at the table reviewing this, because community voices matter. And also we want to have content that is relatable and received well by the community that we're making it for. So
yeah, and sometimes we forget, and I've said this over the years that we were doing the Flint community webinar during the COVID crisis, and even the work that HFRCC is HFRCC because of the water crisis. Even though we can be professionals in the active work of research and in the medical community, it doesn't mean that we're no longer community members. So when we say community members, we want to make sure that it's understood we are not separating ourselves from the community. What we're doing is acknowledging that sometimes I forget to take my research hat off. I forget to take off my scrubs and understand that I'm a nurse, but I'm also a community member. And COVID was very interesting because it forced everybody to do that. At the end of the day, when you realize I cannot go home because this virus can be on my clothes, it can affect my family, everything has to come off. And it's important to me that we always communicate that message that we are not dividing those who are professionals in the field from community members. We are all community members working towards the same cause, but because of our profession, sometimes it can be difficult to take that hat off, and we need each other to pull us back into that everyday reality of just being a person who lives here.
Absolutely. It is going to take a village. If you've been following the podcast and our information, our hashtag, and I believe, we can credit you for that, is Be the Village. It's going to take all of us to make any marker, any impact. I want to continue our conversation, and really, both of you have shared how it's not just an individual problem. It's not just that mom, but it's also the community that she lives in. We often talk about social determinants of health, how that environment surrounding the mom, her partner, as well as the child once it is born, and even in the womb. Nina, you made a phenomenal point about the lead in our environment. Even if you never have a child, we don't know what that looks like internally. Also, providers, It takes 4 different layers for us to actually make a full impact. We can put a Band-Aid on the situation, but we want long-term change. The providers, we had the opportunity to have Dr. Brian Tessler on the last podcast, and you could hear his passion for his work, being able to bring forth that miracle of life. But he, even on his soapboxes, as he mentioned, that there's things in the system that need to be changed. Having more time with that partner, that patient, their partner, and their support system, the system does not allow it. So one of the things with the app, we are looking to address all 4 levels of the issue, every level. The pregnant mother, even 18 months after she has delivered, her community. And that could be aunties, that can be grandmas, that can be their birthing partner, so many other people that support her, doulas. Then you go into providers. The providers are those with not only the years and all those letters behind their names, but having the passion to make change. I don't know too many people that go to medical school to not make an impact on some form for some reason in health. And then our system. The system is doing what it was designed to do. So we're doing some restructuring now in the system, changing the infrastructure so that there is equitable health across the board. I did want to so that image, I'm a visual person, as you guys know. So that image was one of the ways that we can show that there's a lot of work to do. And it takes all of us at the table, and it takes you in community to do your part to share this information. I do want to mention too, please drop any questions you may have in the chat, and we'll have the panelists address those as well. Let's move a little bit into technology. Nina, I'll start with you. You brought the Apathon here. Tell us what that process was about. Like most folks say, I'm a geek. I'm a nerd. I love technology. I have multiple screens and all this good stuff. How did you make that happen and bring that to our community?
Primarily relationship, because anytime you're saying something new that people may not have heard before, and I'm speaking specifically people in my network that have not been introduced to anything like this. And at the time, I had not seen anything like what Steve had introduced to our group. And so relationship is always that first step of introduction, because building relationships with people in the community helps give them an ear to what it is you have to say. And some people will only come to the table if they have trust in the person who invites them to the table. And that's just the reality of community. How many organizations do we have? If we're just speaking specifically about Flint, Genesee County, how many organizations do we have that are consistently trying to put on great programming and have resources available to our community? And if you go to any event from one organization multiple times, you may see the same group of people that show up every time. And it's not a shot to the organization, like you all, you're not talking to anybody else, but they've developed a level of trust with this portion of the community, and they're going to go to that event because they believe what is being said there. So I knew it was new to me. So I had to use relationships that I had to ask people to come listen, come be a part of this. And that's, as a group, that's part of what we did between the MSU group that started. It was a much smaller group. And then the rest of the group and staff at HFRCC, we had to just share messages with people. This is something new. It's something that, I think is pretty cool. And my people know me to be somewhat of a wild card and a nerd in some areas. So there are some things that just random knowledge I shouldn't have, but because I'm always paying attention to random stuff, I have it. And so I told, this is something you have to look at. And then the second part of that was making sure that our messaging was not condescending, to say the least. Oftentimes when it comes to the topics surrounding our medical community, the divide is language. Mm-hmm. And again, sometimes if you're a professional in that field, you just forget to take the hat off because you're talking to colleagues all day. So you're using the language you talk to colleagues with. Mm-hmm. And you forget to take that hat off. And now you're talking to a community member who may be a professional in their field, but they're not a medical professional. So now the things you're trying to share with them sound like, oh, you think you better than me now. Mm-hmm. And that's not the case. We've just forgotten to take the hat off. And that's been a practice for me mentally, coming out of one space, going into the next. Take that hat off, remember where you're going, and have a different conversation. And so when we started to have this conversation and bring people to the table, making things very relatable to what all of us see and do every day, and using language that really matters, things like ownership. This app gives us, this technology gives community ownership of the message. Absolutely. So it's not just the researchers and the doctors and the nurses and the community leaders that are saying, here's the information, here's the data, here's what you do. It's the community being able to have those things translated to them, understood, and then them saying, well, if I was on the other side, if I didn't understand this language, how would I communicate this to somebody that I love? Why should they listen to me? If it's going above their head, they're not going to listen to this. If the images don't reflect the environment they come from, they're not going to pay attention to this. And again, it's not that we are no longer a part of the community. It's just that where we are in the community may look different from where somebody else is. And that message just may not translate the same way. Mm-hmm. So a lot about bringing the Apathon was mainly using those relationships to give ownership back to the community, to take control of the messaging surrounding the crisis. And the first one we did was specific to COVID. And at that time, we had messaging that at that time, none of us really understood it. And every week, and Mary Katherine can testify to this, every week on the webinar, it was new information. Mm-hmm. It was something new. And what we had to retract every time, and we had to be transparent every Friday and say, we know we said this last Friday, and based on the data we had last Friday, this was what we knew to be the best option. Now, since we've learned in just these few days something different, we're asking you again to trust us. Mm-hmm. And know that this is the best option now. Mm-hmm. And so once we started that training, we started to see a lot of different webinars pop up, a lot of different virtual sessions pop up, lots of sharing of messages. And social media, of course, was it was chaos, because the access to information went hyper speed. And everybody who had an idea of what COVID was, if they had a dream, they put it on the internet and they said it as if it was law. Mm-hmm. Like, this is the law. I had a dream last night, and I guarantee you that if you have COVID and you get the vaccine, your whole foot gonna fall off. I had a dream, I'm telling you. And people were hearing these, seeing things. And it was almost like, who in the world do we trust? What do we say? And it became our mantra to continue to say trusted voices, giving the community all the information that they needed to have to make the best decisions for themselves. It was very important on my part that we made sure to share, even in trying to build this app, we are not trying to force people to do what we think is best for them.
Right.
About making sure we have the best information available at that time and making sure the community has it, they understand it, and then they can make the best decision for themselves beyond what we feel we're going to do and the choices we make for us and our families. And so once we started communicating that, the ear was open from community. Like, yeah, that makes sense. I want to know how this stuff really works. And then if we could put it in the form of an app that people can have right at their fingertips, that sounds great. So now it's not just everybody else telling me, this is your neighbor. This is, your aunt, your close friend who has access to trusted information and that's sharing it with you in a way that is not aggressive in telling you how to make your decision, but here's the information so you can make a decision.
Absolutely. The webinar was a tremendous tool for our community and globally, actually. And kudos to, and I want to give flowers where flowers where is due to Miss Yvonne Lewis, which happens to be your mom, one of my mentors. The work of HFRCC, also Dr. Susan Wolford was a huge part of that webinar, and the work of HF, and I could go on and on and on.
Yeah.
But I wanted to make sure that I gave Miss Lewis her flowers. It's you also mentioned, and I wanted to jump in and say mistrust, misinformation as well, because it was so chaotic. And the beauty of technology, being able to do things, to find interventions at warp speed, but also having to say, no, that's not real. Don't, it's a balance, and it is tiring, but it's worth the work because we know that the community needs the information to make those informed choices. Thank you so much for that, Nina. Mary, how is this? Tell us a little bit about your educational background and how you got involved with science. Is it?
Yeah, so educational background, once I completed my master's in public health, I came right to MSU, and actually was instantly working with Miss Nina Lewis on the HFRCC community webinar from the MSU side when I was at the Flint Center for Health Equity Solutions. So having come out of fresh out of school, right, and landing in, like, literally coming out in January and then finding myself immediately in pandemic was quite the experience. So after my time at FCHES, I went over to become the project manager of SIAS, so the computerized intervention authoring system. And once again, I think this goes back to what Nina said about, you see sometimes, the odds of seeing the same people in the room and at conferences and community meetings and webinars. Of course, Nina led the Appathon, and as she said, it was about vaccine hesitancy. So my role, of course, as project manager, right, I had to obtain a, level of expertise when it comes to knowing how to operate and what SIAS is capable of. I try and break the code on deployments, and so yeah, you have to know the system for that. And that's kind of how I wound up working again with Nina as one of the Apathon coaches, and someone, kind of just a general resource for information if participants needed it. Nina, I instantly thought of when we were talking about community and messaging, is how probably by the time we had that Apathon, we, had vaccines. And of course, we were doing vaccine hesitancy. And I just will never forget, I had been writing content about vaccines for how long at that point, and never once, the second science is in the hands of community, one of the first questions they ask, is when they're asking about vaccine hesitancy, one of the questions they listed was, because, I'll just have a ginger ale and a nap and I'll be fine. And so talk about, like, I've never written a question, like that after how many iterations of how many interventions I might have worked on. And so again, when you like that, it's such a simple but perfect example of the importance of community, to take something that has been politicized and has become so controversial, and bring a group of people around to address it as a public health problem. Take it and make it relatable. They break, the tension of it. It's not, disrespectful. We're considering, cultural norms. So I have always been super excited to see what comes out of Apathon, and the same is true for the intro for the My Mom app that our teams are going to build. So.
Nina, I want to ask you the same question, and it's leading. What is your educational background in? Is it technology based at all? And thank you, Mary. So public health and Nina, you're muted.
Absolutely not. Absolutely not. I am born creative, and that is where I'll stay. I have my bachelor's is in sociology. And I was studying, people as a storyteller and a writer and an author. I'm like, this is what's necessary. I need to understand people and what they do. And as I'm doing that, always been born a community volunteer, because as you said, my mother is Yvonne. I didn't have a choice. So everything was community. And it's hilarious because all of her children, all four of us are in community, no matter where we live at. It's once my brother got in there, I was like, oh yeah, we were born here. And then I got my master's degree at Johns Hopkins University in the liberal arts program, and part of my study there was about how to focus the artistic into teaching into the academic. And so one of the papers that I wrote and actually presented at several conferences was how people have become addicted to superhero movies. And it was a whole thing. And people came specifically because she's crazy. What is this? And so in every space, I'm always trying to figure out what is the most relatable thing. And then how do we create solution from that? Because if I can't relate to you, I can't speak to you. And so it's always this translation of what is around us and what is the common theme, and at that particular time when that was written, we were seeing Black Panther was coming out, and it was the biggest thing we had ever seen, because we had never seen a live action superhero movie with predominantly Black cast. And it was just around the world, people were building movie theaters just to be able to see Chadwick Boseman play this part. And as we were looking at community, and even in the app building, at one point, one of our community members, Dominique, who is also an influencer and a very influential person just in the community, we were having this conversation about the effect of superhero movies, the resurgence of, love of comic books and all of these things. And Steve came over and was just like, what is happening over here? Because this is so intense. And we were using that and relating that to how we're communicating, even about building this application. All of this, anytime you're dealing with something that is a medical condition and people start to lose their lives from it, it becomes an area of vulnerability for people. And some will not open up about it. They don't want to admit the reality of it because we don't have that sort of general societal sensitivity training. How do we talk about these hard things? But if I can get you to talk about it, because I first start talking to you about comic books, and by the end of the conversation, you've agreed to go see your doctor, okay, then it works. Thank the thousands of dollars I got to pay Johns Hopkins for this degree. Because eventually it all works.
Absolutely. And I brought that up because, yes, you're very beautiful. Yes, you're very intelligent women. But science and these issues are for everyone. Not everyone's as intelligent as we are. Not everyone's as appealing as we are, right? They don't have the connections. The mom who brought down the gene pool of community engagement, and just thinking about how it takes a village for us to bring everyone into this space. And science. So Mary, my background, my bachelor's is in computer information systems and business management. My master's is in scientific administration. So I'm like tearing up computers, right? But I bring up the point that that's not necessary to build apps at this point, because the way that Steve built science.
Yeah, correct. Yeah, absolutely. You do not need to know how to code. You don't need to be a developer. You don't need to be a software engineer to build an app in SciAS and, share it with community or anyone, or, post it on a website so that people have access to it. We often liken SciAS to learning how to use PowerPoint to make presentations. SciAS is like that. You learn how to use SciAS, but instead of presentations, you make apps to address critical health problems that our communities are facing.
And I would even venture to say, Athena, that we found even the opposite to be true. That my experience in whatever area of, professionalism you catch me in that day, because it could be different things, could pale in comparison to a person who didn't have the opportunity for the educational intelligence, but they've come in the room and they could pull things apart and bring ideas that we never even thought of. So the presenting this opportunity not only allows those of us who may not be as tech savvy to still be a part of something, but for those of us who, we're told the opposite, that, being tech savvy isn't the thing. Like when I was younger, we were like, get off the video games. You're never going to make anything out of yourself with that. Come on, get off the computer. Don't do it. And now they're the people ruling the world. Like if you can create a video game, you run the world. It's amazing what can actually be done. They're winning millions of dollars from playing video games. And so it's just a different spaces of intelligence that we learn that exist. And so in this space, another reason why I love it so much is because it's not just a teaching space for us to show and train and introduce, but then the community enlightens us on intelligences we just did not we didn't have. We didn't even think of that way. And now here they are telling us something. And then in the next year, what happens? Oh, we have to build this into the appathon, because I remember what Michelle said and what Dominique said. And, you know, I remember what they said. And so now we have something new we can add to the experience, because everybody has something. You know, it's just a matter of getting all those somethings in one room.
Thank you so much, ladies. We're coming close to time. I want to share a couple of things. Let me change my screen. So, as most of you know, we had an appathon. Sorry, guys. Hold on one sec. Okay, it's not working for me. Can you hear me? Okay, perfect. So Nina, I have the slide up. I believe you had something to do with this. We had the appathon, the informational session on the 7th. And for though we have, well, actually, let me build this up just a little bit more. We had the informational session on the 7th. Thank you so much for everyone who came out. We had a room full of community members at MSU that day. Huge kudos to our community advisory board who did some outreach information, specifically Mr. Jonathan McKay as well. And then we said, well, we want a couple more teams. And Nina knocked on some doors and pulled on her network and said, okay, we need some more teams. And we got them involved. Mary, how many teams do we actually have competing right now?
6. We are up to 6 now. So 6 teams, 19 participants. So
kudos to each and everyone. They are competing for $5,000 to build the My Mom app. We are super excited about this. As you can tell, my energy level just went way up. So as Mary is working with these 6 teams to compete to build this appathon that will do many of the things that we mentioned and more, we also need testers. So once they build those interventions, we need folks from you in the community, the greater Flint area, to be a tester to say, okay, this works. Well, this doesn't, I don't see how this connects, or, oh, this is genius. Yes, let me give these all the points that they can possibly earn. Nina, let me try to fix my screen, but just please elaborate more. And I know that the testers is something new that we did this round, but share with us the importance of our testers.
So in the past, we've just had judges, and we've done this presentation. You know, part of the final day was the presentation of the apps, where the teams got an opportunity to share each section of their application, the build, what their goals and expectations were, and all of the messages they were trying to get across, all of the options. And then the judges had to decide which one they thought was the better build. And so the in-between part there that we didn't have were individuals who were unrelated to the project, who hadn't heard all of that information, to actually test it out themselves, to go through the application and make the different choices and look at the different options and see how well the app worked for them. So this portion of it, we're really excited about, because now we have an addition to the judging phase, because we can actually say this app or this app was more user friendly because the testers told us so. So it's very important that we have these testers. And again, if everybody has used the app before, this is common knowledge now. We definitely want testers who have had some experience, preferably had some experience with a pregnant person, new mother, or mother to be in that space. But if your sister, cousin, brother, uncle, and you've watched the experience and you know something about it, or you more professional or more inclined to the technical side, and you just love to experiment to see how different apps work and how well they work, we definitely invite you to be a part of that process. The testers are going to be so very important to this. So absolutely, we're looking forward to people signing up.
Thank you, Nina. One more quick announcement, Mary. I'm going to turn this over to you if you're comfortable. We're also seeking the Brainiacs. So we're looking for postdocs also for internship.
Yeah, absolutely. We're looking for someone to really support this study, Project 2 of, as Athena said, the Miracle Center. So someone preferably who is passionate about reducing pregnancy-related mortality and morbidity. So we are looking for a candidate with a PhD or equivalent in psychology, public health, health communication, epi, or another related field. Of course, with as any postdoc should, someone who has experience with scientific writing and as well as data management and analysis. And because we are in this niche field in digital health interventions, it is preferred that we have a candidate who does have some experience either analyzing or building digital health interventions, particularly in the areas of pregnancy or mental health.
Thank you so much, Mary. And I'm going to shift gears one more time. If you haven't seen already, but please go to our website, pc-pram.org. Mary and the team have done a phenomenal job. Liz Vickers has done a phenomenal job building this app, the website out. There's more information there. You can also go on, learn about the apathon. We're actually doing a second one later in the summer in the rural areas. And this is the link also where you can go to actually sign up to be a tester and learn more about the intervention. Follow us so that you can share this information with your networks. Ladies, we're already at time. Thank you so much for taking time out of your afternoon to join us to bless the community with your knowledge, your information, and your passions. Any last 30-second information you want to share with community?
Just find a way to get involved. You never know where that involvement will lead. I'm a perfect example of that. Every venture that I've been able to get into, and the many careers I've had and many lifetimes that I've had on this earth so far is because I got involved. And so please always take that opportunity to get involved. You never know what could happen from it. I'm expecting an honorary doctorate from MSU after all the work that I've done. So get involved.
Thank you. Mary?
Nina definitely deserves it. Definitely deserves it at this point. I think that just jumping off of Nina's, I would just add and stay informed with all of these community resources and webinars and opportunities. Information doesn't and isn't siloed anymore. I find your trusted, credible messengers and hear what they have to say.
Thank you so much, ladies. I ditto both of those. Get informed, get involved, stay active, stay healthy. Whether you are a mom or planning to be a mom, if you're a support person, if you're here still today, by the grace of God, you got something you're supposed to be doing. Take care of your body. Take care of your environment. Take care of being part of the action to make this community a better place. Thank you so much, everyone. Take care. Thank you for joining. Please share and like so others can be informed. Take care.